Thank you. I'm Julie Goodman, and I just wanted to say hello and to say thank you so much for giving us this opportunity as a trust to share the exciting and passionate work we've been doing since COVID to try and improve the experience for our patients and our families. So I'm Julie Goodman, and I'm the I'm the trust lead for Complaints and PALS, and I'll just get everyone else in the room to introduce themselves as well.
I'm Sarah Crane, I'm the lead chaplain.
I'm Sarah Woodfield, the Voluntary Services Manager.
And I'm Lisa Barnes, the Senior PALS Officer.
So once again, thank you ever so much for this exciting opportunity. So we're going to take it in turns to go through the slides so you don't get fed up of our voices. So first of all, what we wanted to do at the start of this is reach out to our families and the patients, because this was a difficult time for all of us. And we thought, especially for our patients who were in hospital at the time. So we wanted to make sure that we helped them through this difficult time. As you all are aware, that during the COVID pandemic, patients have not been able to have visitors come with them unless there's particular circumstances like they're at the end of their life. We just thought that we needed to put ourselves in the shoes of those patients and the families of those patients and think about what it must feel like to be in a strange place without anybody able to visit you, without your familiar faces around you, without your familiar things around you, and what it must be like for those families at home that couldn't come in to see their loved ones, like they would probably most days or every day if their loved ones were at home. And we felt this was devastating for all involved, those people that are unwell, and also devastating for their friends and their family as well. So what we did, as I said at the beginning, we tried to put ourselves in the shoes of our patients and families and feel and think about what it would be like to be in their position if we weren't able to see our loved ones at this time.
As so many have, we really recognise that, as has always been true, that if you support your staff, you enable them to do their best for your patients. And we knew very quickly that we needed to do more for our staff as they were responding to the pandemic, not just at work, but like the general public were in their own lives. So all of our staff had worries about family and friends and concerns about going shopping and the queues and all this infrastructure that we've all had to get used to over the past few months. So we wanted to act quickly, we wanted to respond to our staff's fears to make that inpatient experience and outpatient experience for our patients as smooth and simple as possible. We know that stressed staff don't give such good care. So we did a number of things. I'm going to talk about those a bit later on. We opened a staff hub, so we've now got a dedicated staff rest area that's multidisciplinary. Any member of staff can use it, and we'll talk about that a bit later. We instituted free meals for staff in our restaurants. So if you're working a long day, if you were not able to get home or to get supplies, you could go and have a free meal, no questions asked, in our restaurant. And there was a huge take-up of that. And I guess what it meant was people went home from tired, busy days, well-fed, able to rest well then before they came back to work the next day. Another incredible thing, and we can't take any credit for this really as a trust, but that our friends of Milton Keynes Hospital, who run a little shop in next to our restaurant, just went above and beyond. They spoke to local retailers, and there was this enormous supply of supermarket items now available. You could buy ready meals, you could buy pasta and rice and fruit and veg, you could get bin bags, you could get washing up liquid, you could avoid the weekly shop and all the stress that caused with long queuing and like loss of stock and things like that. They worked so hard to make sure that our teams every day of the week could get food before they went home, so that wasn't an additional job to do. And they are still doing that, and that's incredible. We reached out to staff in quarantine. So staff in quarantine had daily phone calls if they wanted them, but they could reduce down as well. That was true as well for people shielding, but also true for people that were actually unwell with COVID. So that they had an opportunity every day, if they wanted it, to talk to a member of staff. How were they feeling? Did they need any support? did they need to ring 111? What was next for them if they felt they were getting worse, and so on. But also, how did they feel in terms of loneliness or boredom, or how they were coping with their home environment. So I know that had an enormous impact. That was run by our health and wellbeing team and teams around them. That enabled staff to feel safe and to feel like they mattered even though they weren't coming into work. Because a lot of staff felt guilty if they weren't able to come in, either if they were quarantining, self-isolating or shielding. The others are going to talk in a bit about the relatives information line, and that was a really powerful way for some of our clinical teams to work alongside our PALS team to give information to our relatives who weren't able to come and visit. And again, I said they'll talk about that in a minute. And the other thing we did for our staff in their support of their patient is we enabled video calls. So we got loads of tablets, and we've got this app that they're going to talk about. And we enabled those video, so as face-to-face as we could manage it, moments for people and their loved ones, which we know made a really big difference for families not able to see one another in the hospital.
Okay, so back to Julie now, and I want to talk to you about one of the very first initiatives that we actually put into place really quickly, and that was our letters to loved ones. So going back to the beginning of COVID and thinking, as I said at the beginning, about the impact for our patients and their families, not being able to see one another and people feeling vulnerable, we thought about how we could try and help that and make it better for those people. Now, we were aware, obviously, that a lot of our younger patients and some of our older patients, to be fair, they have smartphones and they could video call and do all sorts in this lovely technology world that we're in. But we also knew that there would be people that didn't have the ability to do that. So what we thought about was to set up a facility to enable people to go back to the good old-fashioned way of writing a letter. So I think we've lost that in the world of technology and texting and WhatsApping. So we set up very quickly, as I say, almost overnight, a dedicated email address. This was available from the beginning of April, and we called the email address Letters to Loved Ones. We then promoted on anywhere we could, to be fair, on our social media channels and on the internet, wherever we could, that this facility was available for families to send in their letters and photos that we would make sure got to their loved one on the ward. So this, I have to say, took off overnight. People got the message and they spread the word, and we spread the word amongst staff, obviously, so we were letting patients who were calling our relatives line or calling the wards know that this facility was available. Just to be sure everything was safe and secure, just to let you know, the letters and photos were printed by our PALS and complaints team. They were printed and then laminated and then placed in an envelope addressed to that patient, and we checked what ward they were in so they could be delivered. We then had all staff from all areas helping us deliver those letters, and we would just go to the ward area, ring the bell, the nurses would come and take them from us and take them to the patient. So everything was secure and safe from a COVID point of view. And the helping volunteers and staff have just been wonderful in helping us deliver those. And in the early days, when we run the relatives line 7 days a week, we actually offered the service 7 days a week. As we stepped that down, we then came to only offer it Monday to Friday, but we ensured that the letters got delivered as soon as possible. So there were some patients on the wards that weren't able to read their letters themselves. And so obviously for those patients, we made sure that volunteers or ward staff actually read those letters to them. The letters have also been read to patients who were so sadly at the end of their life. And I know Sarah, who's with us today, helped us with that and with reading those letters to our patients that were so sadly at the end of their life. And the hope with that was that those words from their family and their loved ones would just bring comfort to them in their very last hours. So the impact of those letters was absolutely astounding. It brightened up the patients' days, it brightened up our days, and it brightened up the days of the ward staff. We felt very honoured to be part of this and to be giving that love to our patients from their families. And we received many compliments for the service that we were undertaking. Another side to it was that we had children's contacting us, especially through our deputy chief nurse. Her village school wanted to do something to help. And what they did is they made cards, just to that could be given to any patient, and they addressed them as dear friend. They were brought in, they'd coloured them and made them absolutely beautiful. They brought Sam, our deputy chief nurse, brought those in, and we laminated those. And so what we were able to do with those was to give them to people and patients on our wards that perhaps hadn't had a letter and had seen other patients receiving them. So as I say, the letters, the photos, absolutely heartwarming to read and heartbreaking at the same time. As I say, some of those people, including our young and old, were coming to the end of their life, and that was really sad. But the patients absolutely warmly welcomed the cards being received. We've got a particularly nice story for a couple of our patients, because obviously as we were checking where the letters had got to go on the wards, you became aware of we needed the patient's date of birth to be able to track them in case they'd moved wards. And we became aware of a couple of people whilst the cards were being delivered and the letters, that it was actually going to be their birthday whilst they was in hospital. And we just thought, how sad, they're in hospital for their birthday. Not only are they in hospital for their birthday, they're also away from their loved ones and their family and their friends, and wouldn't have the normal birthday. So as a team, the Complaints and Powers team, as a team, got together, and what we did is we brought a birthday cake, obviously checking that the patient was able to have that cake before we did it, and we had a birthday card and put that together and laminated it, and we then delivered those to the ward to the patient whose birthday it was, and they were obviously truly bowled over by that gesture, and it really helped them get through the day on their birthday. So to date, we've had over 1,000 letters and photos delivered. But I think what I just wanted to end on was a bit of feedback that we've received, and then I wanted to tell you quite a special story as well. So the kind of feedback we have was we really appreciate what you're doing for your patients and our dear ones. It's so comforting for them and us to know that they are to know that they know we are thinking of them is tremendously satisfying. We're so grateful. Well done. Thank you, and thank you again. And then another lady said, thank you so much for your efforts over the last 11 days, sending all our letters and photos to Mum. So just to say there, we didn't put a limit on how many letters or photos someone could send. They could send them 3 times a day if they wanted to. Another comment was, you and the team have my unending gratitude. You have made an unbearably awful situation almost bearable. And they go on, you're doing a wonderful job. Sending us, as staff, their best wishes and hoping that we were keeping well in our families. So, as you can imagine, being on the receiving end of delivering and a really good service and receiving those comments was lovely for the team. But one story I just wanted to tell you about was going back to my birthday cake. A gentleman that had, we delivered him birthday cakes and a card. He was actually the gentleman who agreed to take part in an ITV documentary that we were part of, which you may have seen a couple, 2 or 3 months ago. and he spoke to the presenter of that TV programme. Now, as I say, that gentleman, it was his birthday, and we did deliver him a card and cakes. And he appeared on the TV programme. Unfortunately, that gentleman passed away not long after that. So the family of the gentleman involved have been so grateful to us for what we did for him on his birthday. But most importantly, what they have is a treasured memory, and that they've got the recording of the TV programme. And for his family, that was, some of his family, that was the last time they heard him talk. So that's just a lovely story to end on, albeit very sad. The gentleman passed away. We at least made that a little bit better in these awful times for that family. So thank you for listening. I'll pass you over now to Lisa.
Yeah, hello, it's Lisa from the PALS team. So yeah, I'm going to talk to you about the relatives information line that we set up. This was an idea to try and support families who are obviously very worried about patients not being able to visit them, but also to try and support the wards at a time when they would have been inundated with phone calls from worried families, and just try to allow them to concentrate on what they needed to do, which was obviously care for their patients. So this was set up from the 1st of April. It was a dedicated telephone line that would allow patients and family to have an update on how they're doing. It was run by the PALS team along with a couple of registered nurses who weren't allowed to work on the wards at the time. So again, it gave them something to focus on as well. It was sent out on comms on all our social media and added to our internet and intranet to make as many people aware of the service as possible. Obviously, switchboard were also aware, so they knew if patients called for or families called for an update, then they could put them straight through to that line. So as I say, started on the 1st of April. To begin with, it was covered 7 days a week by 2 registered nurses and admin support from the PALS and complaints team. The registered nurse had full access to all the patient's records and would be able to provide a comprehensive update. Obviously, that's after taking all the relative data protection checks to make sure that they were actually speaking to the next of kin. They also did have support from the ward if they needed, so if there were questions they weren't able to answer, then they could ask the ward for those. At the peak of the service, it was receiving between 35 and 40 calls a day. So it was a really, really busy line. So obviously a very needed service at that time. There were lots and lots of really positive feedback. Lots of the same people calling each day. So they obviously found that a real great source of comfort, and we got to know the relatives as well. So formed quite good relationships with some of them. And we've heard some updates from some families as well, from patients who've been discharged, just to see how their families are doing, things like that. It was definitely something that we do again. It's not currently needed at the moment, but it's all in place if we need to set it up again. And actually, regardless of the pandemic, it's a really useful tool to try and support wards if they're particularly busy as well. So it's definitely something that we'd bear in mind in the future. Thank you.
Okay, so it's Sarah, the Voluntary Services Manager. I've got a few initiatives to talk about that were implemented at the beginning of COVID. One in particular was the patient bag drop-off service. It was apparent very early on that because we couldn't have visitors to the hospital, patients were in need of fresh nighties, fresh clothing, some refreshments, things to keep them occupied. But with families unable to visit the wards, we had to implement something quite quickly. We advertised the service for relatives to drop things off to our main reception. We set up a COVID safe station where belongings could be dropped off and logged and securely kept. And a rota was devised with our volunteers who were willing and able and safe to volunteer. This was started on the 1st of April, and we've used approximately 24 volunteers over that period who were able to come back We've had lots of changes. It's been quite a job to make sure that that rota was staffed with volunteers. We've had lots of people go back to work and go and leave to go back to university, etc. But we have approximately 14 to 15 volunteers who cover a morning and an afternoon shift every day. When we started this, it was a 5-day service, Monday to Friday, between 10 and 2 o'clock. It became apparent very quickly that it wasn't enough. This went to a 7-day service, including the various bank holidays that we had over that time. And we increased our hours initially from 10 till 3, and they now stand at 10 till 5. We also have an out-of-hours service, which is supported by our security team at our main entrance. So they take and log belongings that are received after 6 o'clock, and that they contact the ward staff if they're able to come and collect those belongings instead. If not, they're locked away until the volunteer can come the next morning. Since its inception on the 1st of April, the reception team and our rota of volunteers have handled and delivered 6,891 bags as of yesterday. So this is a service that will continue to run because we still don't have many visitors on site. And as you can see by those numbers, it's a service that's well and truly needed and people are really grateful for. We also had a cohort of 189 volunteers who all of a sudden lost their lifeline to volunteering. We stood down all of our volunteers initially, and it became very clear from those early conversations that we had with volunteers that their volunteering shift that week could potentially be the only time they had proper contact and conversation with people. I felt very privileged to be at work, and it was heartbreaking listening to some of our volunteers not be able to come in and do what they loved doing. We were really concerned about their mental health, so we introduced wellbeing calls and general assistance. We had 2 volunteers who we did some regular shopping for because both him and his wife had to shield. So we regularly had his shopping list, which always consisted of chocolate donuts, that real essential to your weekly shop. They were so grateful, they really were. And that's something it has petered off now. They've got the support around them, so they don't need us to do that as much now. But we do make weekly and fortnightly calls to our volunteers. There's 49 of those volunteers who wanted us to keep in regular contact with them. So as a team, we've got a rota and we call those volunteers just as a check-in, just to make sure that they're okay, and to see if they need anything, if they have gone into shielding or they need to be isolating, if there's anything that we can do for them. But we do plan to continue this for any of our volunteers that are absent for any reason, so that it becomes a bit more of a business as usual plan. We also started holding fortnightly Teams calls on Microsoft Teams with our volunteers. This has been received extremely well, and has provided the volunteers and our voluntary services team an opportunity to get to know each other a lot better. It's generally conducted as a social call. Obviously, there was some updates at the very beginning about where we were and on the hospital. But this is now widely known. It was just a really nice way of keeping our volunteers engaged. We always brought a cuppa with us and a slice of cake, and it was a real just getting to know each other, finding out what people had been up to or what they couldn't do, what they were missing. And they also wanted to know what we were doing and that we were keeping well, and what we were managing to do. And we've continued to do this on a monthly basis. And they really do look forward to it. They're really grateful. We get lots of positive feedback that we've remained engaged with them, regardless of the fact that they can come into the hospital. And we've even started doing a little monthly quiz. Another service that the voluntary services team and the patient experience team were involved in was the collection of property from those patients that had sadly passed away from COVID. Ordinarily, families would have been with patients on the wards during their last moments, and at that point they would take home that property. It was a service that was needed quite quickly, and it needed to be handled quite sensitively. So we implemented a new service with our bereavement team, the wards, and our security teams, so that we could collect the property that belonged to those deceased patients from the wards, and ensure it got handled appropriately and handled back to the next of kin. This process was new to all of us. We hadn't, experienced anything. We had to source a room to keep the property in and make sure that if any of the patients were COVID positive, that their property wasn't touched for 72 hours. And we made sure that everything was recorded, everything was packed appropriately in a dignified way, so that if the relative was receiving that, it looked like it had been cared for with love and compassion. We handed this service back to the bereavement team in August, so they now continue that service. But in the time we were involved, we handled 106 bags of property, speaking and dealing with those next of kin.
Hi, it's Julie again. So as I sort of mentioned earlier, there's lots of technology out there nowadays where people have iPhones and phones can contact their families. But we did have quite a lot of patients obviously didn't have access to a phone or an iPad. So we were really lucky as an organisation in that some mobile phones were donated to our hospital charity, which enabled us to use these across our wards to enable staff on the ward to help patients without a phone to contact their loved ones. And we did this using the NI app, which is the health app for connecting patients and their families. It was trialled on one of our wards, Ward 24 first, and very successful. So then other wards followed suit. And of course, we also, as an organisation, helped our patients to use their own phones to connect with their families if they were having problems in any way, and used our own iPads to make Zoom calls. There was one particular situation on our Ward 3 area in which the family were all in Australia and across the world, and using our iPad we were able to connect our patient with her family, and that was obviously really well and truly received. So thank you to that company that gave us the mobile phones, because it was priceless.
One of the initiatives that our teams put together was called Hold My Hand, and it was our therapist that thought about this and how important they thought it must be. Obviously, holding people's hands in hospital is really important. It makes you feel less alone, doesn't it, to have someone holding your hand? And often, as we've said, you have your visitors doing that, your loved ones, the people that you know well. And most of our patients were not able to have visitors, or certainly weren't able to have the visitors they would normally have. So some of our therapists, some of them were very, very busy, obviously, but some of them had a bit more free time, so we have fewer patients in hospital. So they banded together to form this Hold My Hand group, and they would keep in touch with the palliative care team and the ward teams. Was there anyone particularly that was lonely, but also even more so, was there anyone who was really unwell, who might be coming to the end of their lives, who may have a visitor for some of the day, but not all of the day, where they could just sit with them, hold their hand if they wanted to, and be company and just that other human being sitting alongside them. And they saw an awful lot of people and spent an awful lot of time with them, and that was really powerful for them. And I think it's changed the way that they see giving patient care, even now that they're able to do that in a very different way, and obviously our cohort of patients has changed significantly across the last few months. I mentioned earlier about how we wanted to look after our staff, and one of the bonuses of COVID, perhaps, we can admit, is that there was funding to do things for staff, and it's been really good even this week to see how the funding for staff and looking after staff is a priority going forward. I'd long wanted us to have a owned by any particular group of people, non-hierarchical rest space for staff. I feel that's really important, that we've got space to decompress and rest and relax, so that we can do our jobs better when we are working hard. So I was delighted to be offered this space and to be given the funding by our hospital charity to kit it out back at the end of March. So we turned it around in about 10 days. We had this former clinical space that we got carpeted, we got lovely furniture, we got free tea and coffee and biscuits. We'd had loads of donations. People were incredibly generous, so we were able to give out all sorts of goodies. But more importantly, our chaplaincy volunteers, who would normally be out on the wards seeing our patients, were able to move off the wards, as all our volunteers did. And 7 days a week, we had someone in that staff hub 10 till 2, and this is what we're still doing this. We were able to offer that listening ear and provide that support to them. I'm delighted too that this isn't just for COVID, that we are giving that room up, but that's because we've been given a larger space that's being purpose-built kit out that will be ready next week for us to reopen, and that this is a permanent part of what our staff are going to be given going forward.
Okay, so we're now starting to think and see what we're going to carry on doing. Our letters to loved ones, as we spoke about at the beginning, we're absolutely going to carry on with that, because we see even when visiting comes back, families now live far and wide, and not everybody can come and visit their loved one when they're in hospital. So we're absolutely going to keep that running and keep advertising that as a service that we offer. As Sarah's already alluded to, the bag drop, so successful and helpful for our patients and families. That will carry on until visiting is back to normal, whenever that may be. Sarah's spoken to you about the staff hub and the fabulous new facility that we're going to have available to us. We've got it now, we'll have a better one next week. And now I think with the wards using the communication technology that they have, then there'll be no going back from that. And with communication, as you know, probably being one of the main issues of hospital complaints and feedback is an issue. We're hoping with the use of communication technology that will become less of an issue moving forwards, because we can connect with our families. And Sarah's going to carry on, as she said, with our wellbeing calls to our volunteers and keeping in contact with our volunteers, and even when they're fully back here as well. So what we have stopped, as Lisa referred to earlier, we did cease the relatives information line once the wards were more able to take calls from the from families. But again, as Lisa said, this is absolutely there, ready to go, be up and running in a matter of hours, should we need to revert to that if we go into another pandemic situation or visiting can't start as quickly as we hoped. The bereavement team now, as Sarah said, are now dealing with a deceased patient's property. So for the future, what we're saying is we think this has changed the organisation, I think as a whole, in that we've been given the chance to think about our patients and our families more, given more chance to think about our staff, and given the opportunity to know that we can make changes very quickly, and it doesn't have to be a period of months and months of negotiation to make changes. So that has given us some lots of passion and lots of excitement for the future, about how we can change the experience of our patients and families and staff. So currently we're trialling a visiting app, so we can gradually start bringing visitors in to the organisation in a very structured way. Thank you, girls. And we've got an app that will also help us then track and trace who's been into the organisation and when. On the wards that's already been trialled on, we've had 1,000 hits on that app already, and we're currently looking at rolling that out onto a further 8 wards in total by the end. The relatives line that Lisa spoke about earlier, and the clinical involvement from a clinical member of staff that was available to answer those questions immediately by looking into records, has opened up a whole new world to us, and we're now looking actively to bring a clinical person into the wider patient experience team. So that clinical person would look at patient experience, but would also be there to assist and help our pals and our patients and families that come through our PALS and complaint service, and help them and hopefully get some of the questions that they ask answered quicker, so we can give a good service to them. Communication, as I said, is a massive issue for all of us across the NHS. And so we're looking at more improvements to make that better for patients and their families. So we're planning to revamp our sister rounds, put those in place when visiting is back. We had started before COVID on some wards trialling some welfare check calls once a patient is discharged. That now is ramping up again, and we're going to be taking that across the surgical wards initially and then onto the medical wards. The physiotherapists, doctors and nurses are already working together as an MDT after every board meeting, board round meeting on the wards in the mornings and afternoons, and they take an MDT approach to ensure that relatives are kept updated on their loved one, and they take it in turns to make those telephone calls so relatives are always aware. So that is the end of our presentation. Thank you so much for listening, and we've been absolutely delighted to share this work that we've been so passionate around with you. I just wonder whether you have any questions that you would like us to know.
Yeah, I think thank you very, very much indeed for that. This is Brian again. That was immensely powerful and very, very moving, actually. I found the whole experience of listening to your presentation incredibly moving. I know that probably Rachel has got some questions in from the group, and if anybody else has any questions, just use the chat facility. I just wanted to talk about the speed of change. You know, all of this happened very, very quickly, and is there something there to be learned about how we can, we can sort of divert away from the formal seeking lots and lots of permissions and just getting on and doing things? Do you think that there's a culture change at all being brought about as a result of COVID in your hospital?
I think absolutely. I'm Sarah, I'm the lead chaplain. I think one of the big things that I noticed was that where you work and what your job is seemed to no longer be that important. And I mean that in a really positive way. It wasn't like, well, that's not in my division, or actually that's not my priority. People came together more, they worked together better. We didn't seem to have those kind of, I'm working over here, you're working over there moments. And I thought that was incredibly positive, and something that if we didn't carry on, I would be really disappointed in.
Yeah, I think
that's the permission to act.
I think that came through to me very strongly, was that clearly there is a culture change now, and you're determined to grasp hold of that. Rachel, are there any questions from the group?
Hi, yeah, I just want to say again, thank you for an incredible presentation. It was really, it really touched me, and you really did put the patient first. And as Roy says, start with the patient and work backwards. You have definitely done that. And I guess with extraordinary times becomes extraordinary things, and you have definitely done that. So yeah, we've had quite a few comments saying great presentation. How lovely to celebrate their birthdays as well. Fabulous work, team Milton Keynes. Thank you to MKUH, great positive work, and so important to have personal approach. Also similar work taking place in community hospitals outlined in the FAB campaign pages. This is so moving, what a great initiative. We have a question here. Wonderful, thoughtful initiatives thank you for sharing. Oh, here we go. Yeah, interested in learning more about your visitors app, please.
We've not actually been involved as a team here today in that. So if anybody wants to send through to me, I can put them in touch with the right person that could give them a bit more information about that, because I'm not very techy myself. But yeah, so if you can give our email address out, Rachel, to that person, I'll be more than happy to put them in touch with the right person here.
Yeah, I could do. Are you happy for me to do it in the chat?
Yeah, absolutely. Yeah.
Okay.
It sounds good.
Sorry.
So you say yesterday it limits the amount of people that can be in one space within a certain time period. So it's obviously got quite clever ways of making sure that people are well spaced out as visitors, which if you were organising that manually would be really stressful, wouldn't it?
Yeah.
So it's obviously a really good use of technology.
Because quite a few people have mentioned that, so I'll put those emails in. John Bessie says we are doing a project in Milton Keynes which includes MKUH as a partner location to support. So I was wondering if there was a way to support these initiatives as part of our project.
MK Place.
Who was it from? Sorry, MK Place.
MKU Milton Keynes is John Vesey.
Yeah. I know there's work happening with the councils and the CCG to try and join up the dots for patients, so that if you're being treated or looked after by one group, that there's that overlap, that it doesn't feel like you're being passed from one organisation to another in that disjointed way. So I think absolutely, I think our hospital we're very passionate, and I know our director's very passionate about us working across Milton Keynes in a joined up way. So again, get in touch with us. We'd be happy to follow you in the right direction for that.
I'll definitely put that in now. And there's another question by John Beatty. Do you know how the visitor app was funded?
No. We don't. No.
We're being really helpful.
Lots of questions about the visitor app.
Yeah.
Sorry.
Our IT team have worked incredibly hard and been incredibly innovative. We're just so impressed with them. Even in the last week, we're one of 2 hospitals in the country where you can download your health data onto your iPhone health app. And that's, so you can look at your own scans and your own messages and your own patient information. And I think healthcare's got to move in that direction, hasn't it? And COVID's been a big push to lots of us to think about how creatively do we work for our patients to make sure that things are as simple as possible for them.
Absolutely. There's another question. How was this received by leaders in the trust, i.e. the trust board?
They absolutely, all our initiatives, they absolutely love them all, obviously. And we've done quite a few presentations to the board to make sure that they're fully aware of the updates on all the initiatives. So, yeah, really received well.
Brilliant. I really love the letters to loved ones. I think that is just so important. And it's really great that you're going to keep that, the no going back, the hashtag no going back, and keeping some innovations. That is brilliant, because that can be a problem for patients, pre-COVID, and wasn't really addressed. So it's great you're going to keep that initiative.
Thank you, Rachel.
There's one more. Was there training for volunteers with the bereavement side? And Brian, do you want to ask your question? Do you want to expand on that?
Yeah, I work with volunteers in the community, and it's a hard job being a volunteer. I'm a volunteer going in round about older people's houses in our community here in the Black Isle, and I sometimes feel that we need more training for volunteers. And I'm just wondering, in the light of COVID, is there anything to be learned there in terms of training and supporting volunteers in the long term?
So our volunteers as such didn't deal with the deceased property service that we had. That was actually handled by the voluntary services and the patient experience team staff. That wasn't issued to volunteers at all. I don't know about the therapy staff having that extra. Yeah, they were provided with extra training when they were doing the Holding Hands initiative. And we are actually looking at the moment about having some end-of-life volunteers, which of course will have substantive training with regards to end-of-life and bereavement.
That's tremendous stuff. When I was working in the trust, I had the job of looking after complaints as well as other things. And as I think some of you mentioned, complaints is all about communication in my experience. Do you think that this sort of experience that you've gone through is going to reduce the number of complaints for the future?
Right, I think it will, because I think it's made us focus on the communication issues particularly, and I'm starting some streams of work from our patient experience operational meeting to look at the themes from complaints, which obviously, like you say, communication is the worst one. So we've got our transformation team working on a patient experience improvement plan as well. So we seem to be a lot more involved in improving patient experience all round. So that will should do, and hopefully will have, bring our complaints down. But at the same time though, Brian, we want to make sure that we do gain lots of feedback from people. So we don't want to discourage people from complaining, because if they don't complain, we don't know what we're getting wrong. So let's hope that it does, because basically, at the end of the day, we want our patients to have a really good experience, and our visitors and families. So that's what we're aiming for. That's our big aim.
Yeah, it's terrific. Really good. Any more questions in, Rachel?
No, there's no more questions at the moment. I just want to say again, it's incredible the work that you're doing, and it really shows that communication and focuses on how difficult it can be for patients and their families. And I think not having visitors and having that line where family members can call. My gran is in hospital at the moment in Wales, and no visitors are allowed. And there is a line, but it's not manned the same way that yours was. So I think it's just the importance of that peace of mind for families, and also patients, because I've personally been in hospital 4 times during lockdown, and I know I was stressing when my family didn't know where I was, just having that peace of mind for the patient. So yeah, thank you again for everything that you're doing. There's no more questions. I've put your emails in the chat, so if anybody wants to get in touch with Milton Keynes and ask any more about the visitors app, welcome to do that. I think we've got a few more minutes left. So Brian, over to you.
Yeah. In terms of rolling this out obviously you've used the opportunity very well today indeed to do this. This is what today is all about, is nicking people's good ideas really in a sort of ethical way. But do you have plans to roll this out in a kind of learning process to other organisations or other parts of the trust?
That's a good question.
It's a good question. I'm part of the Futures collaboration via Helpforce for volunteers. So we do share an awful lot of ideas, and there's a lot of sort of calls out for help if people have already, if people are looking to start a project, a call out for others to help if they've already done it and for any work. So we've been supporting other organisations with regards to the things that we've been progressing on the voluntary services side through that. And I don't know if you guys have got any groups like that, but yeah.
So there's been there's been a lot of chat between chaplains over the past few months. I guess the reality, I can only speak for myself, is that we're just catching up with ourselves almost. So yeah. I don't think I've got any sense of organisation about sharing stuff.
I was going to ask about chaplaincy. Actually. I know that the hub really is a very attractive new initiative. I used to be a Catholic priest many decades ago, and in my day, chaplaincy was really more about interaction with the patients and families and so on. I don't know, I'm probably out of date here, but is this going to be a move towards more care for family, for staff members and so on through the hub?
For me it's a continuation. So I see our service as being responsible for the whole community, And we very much recognise that we can't deliver good patient experience without looking after our staff. So I feel very strongly about chaplaincy being a really important part of the staff welfare team. I guess personally, patients and families take priority. So if it's a choice between one or the other in the moment, we address the need of the patient or the family. But equally, every day we're doing stuff with staff, and the way that works and stuff like the hub is a big visible symbol of that. But I've been here 6 years. There's always conversations, there's debriefs around difficult incidents, there's support after like ad hoc support, there's moments of coming together and acknowledging difficult periods for staff and all those things that might happen, as well as kind of that general pastoral support that just happens day to day. But we know that feeds into patient experience, and that if we don't do that, we get staff that feel uncared for. They feel like their identity's lost at work, and actually there's great research that shows that where we bring our whole selves to work, we do better work. So I guess we see ourselves as being real advocates of that, and anything we can do to look after staff and be part of that loud voice that says that staff are a priority, we just see as part of the positive movement forward for the hospital in general. But our trust has done an awful lot to look after staff, and we're really proud of that.
Well, all I can say on behalf of everybody today, you've set our stream off on an amazing level. It's been really, really exciting to listen to you, and all power to you. You've done a fantastic job. Thank you very, very much indeed for that presentation. Thank you so much.
Thank you very much.
Thank you.
Thank you.
Bye.